Hello student, today we will see one more disorder, that is hypospadias. So what is hypospadias? Hypospadias is congenital abnormal urethral opening on the ventral aspect of the penis instead of opening at the tip of the gland of the penis. Usually you know that urethral opening in a male baby is at the center of the penis, it will be there. But here instead of at the center, it is away from the center, means under surface it will be there. So you can see in a picture, see at the, actually suppose it should be here at the center, but instead of at the center, here it is closed, is abnormally the opening the ventral aspect of the penis. So this is the abnormal condition. Congenital means by birth, the child is born with this problem, hypospadias. So what may be the causes? The major causes itself malformation during embryogenesis, means during the developmental stage or during the formation when the child is in a mother womb. During that time it is not well developed, instead of it is developed abnormally. So you can see in a picture, see this is the normal urethral opening. This is the penis, at the center of the penis, urethra is there, see urethral opening. This is the normal. Hypospadias, what we are discussing now, means a ventral aspect, means below the penis. See, you can see here. This is the one more disorder that we will discuss in a next video. Okay. So what, there are three types are there: anterior hypospadias, middle shaft hypospadias, and posterior hypospadia. That is based upon the thus where the urethral opening is present. Anterior means usually always front, posterior means back side, middle shaft means a middle part. Say anterior means this is the front, this is the penis, the front, this one is a glandular and a subcornal is situated, the urethral opening is situated at the front anteriorly. So this is the anterior. Posterior means backside. So all this is called the perineal, scrotal, penoscrotal. This is all the posterior hypospadias. And middle part is a distal and a mid shaft is a middle. At the center of the penis, the urethral opening is situated. So this is all abnormal condition, okay. The main causes itself is the malformation during the developmental stage. So how to diagnose this? This is immediately after the birth of the child. The pediatrician will be there in a labor room or a OT wherever the mother is delivering. So immediately the pediatrician, when they do the physical examination itself, they will come to know, okay, the child is born with this problem. And excretory urogram means the urogram means X-ray of the or a scanning of the kidney and a urethra, to know exactly where the urethral opening or whether it is involved any other extra organs. Okay, so you can see in this picture properly. See, this is a normal, but it is closed. Instead of here down part, ventral aspect. This is the hypospadias. Okay, if the child is born with hypospadias, what all the problem child is facing or a signs and symptoms? First one is a painful downward curvature of penis during erection as a chordate. Means during while passing urine, the penis will erect. So during erection, the penis will be like this. Chordate means the abnormal, the curvature, bending like curvature. So the child will get severe pain. So due to that pain, the child will cry out. Due to chordate deflector, due to this abnormal curvature, the child may not be able to pass urine standing. While passing, the thigh will wet. So it may require sitting in passing the urine. Inability to void in standing in case of a posterior hypospadias, means the urethral opening is a very backside, means it is of course the child cannot be stand and pass, have to sit. See, if it has to be treated. If it is not treating, means as the child grow and when child is an adult, it will interfere in child's sexual life, okay, in a reproductive ability, So of course every parents, when they come to know child is born with this problem, is they will make it, means they will take the child for the proper treatment. So management, it requires surgical management only, that is a reconstruction to obtain straight penis at a erection. Reconstruction means make it proper, so that a abnormal urethral opening that is closing and normally at the center of the penis, means you are making a urethral opening, that is called as a myotomy. Meotomy done at any age after birth. Cardiac correction, that is only through the surgery. Reconstruction is done. So this surgery is completed before 6 years. When the child is within a 6 year only, they will complete and finish and make it proper, the entire the penis as well as the urethral opening at the right place. So you can see in a picture. Cardiac correction as well as the meotomy. See, meotomy, urethral opening they are making, and this chordate, this bending, they will make it a proper by closing that abnormal urethral opening and making it the center. Okay, this is a surgical management. Meatus means opening. Okay, so what may be the nursing management? As a nurse, assessment include history collection as well as a physical examination. So based on that, nurse has to plan a nursing diagnosis and simultaneously psychological support to parents. Parents might be worried because they doesn't have any knowledge about this, thinking about their child future, what may going to occur. So in a rational way, you have to explain health education. Then regarding personal hygiene after the surgery and how to take care of the child, because child is unable to take care self, so it's a responsibility of the parents after the defecation, urination, to keep the area clean, yeah, and to all every day to change the dress, all that things, and a follow up with all the blood investigation, whatever doctor is saying, exactly to follow that. So these are the nursing management. So hope student you all understood. Thank you.